Hello, everybody. Right now, we have with us just an amazing couple of individuals who are going to share the story, what they're dealing with in this pandemic. We have with us Renee Mathew, who is a healthcare worker at St. Elizabeth and actually is a nurse practitioner. We also have with us Dr. Chai, who is a pulmonologist at St. Elizabeth Healthcare as well. So thank you both for some of your time today.
Thank you. Thank you
So,
for having us.
Well, first, Renee, you and your husband, Dan Mathew, who runs the county emergency communications department, talked to us about your coming down with COVID and dealing with that and being admitted to the hospital and what have you. And one of your doctors obviously was Dr. Chai. So can you fill us in on where you were in April, where you are now, and how are you doing health-wise?
Well, I'm doing better. I got hooked up with Dr. Chai, who's taking excellent care of me. Recently found out that my oxygen was continuing to drop, primarily with exertion activity. So I'm now on oxygen as needed when I exercise or have exertional activity and when I sleep. I'm actually starting to feel better. It's been 8 months, but definitely better than I was before. So right now we're seeing a lot of COVID in the community. So hopefully a little education will go a long way and people will stay safe.
So you actually, back when you originally had this, you were admitted. How long were you in the hospital?
Over a week.
And so since then, you've been back to work for a number of months, right? But still dealing with these.
I was off work about 6 weeks, and then I've been back to work since. So.
Gotcha. And dealing with now these lingering issues that are caused by COVID then, I guess.
Right, just primarily shortness of breath and kind of fatigue.
Okay. So doctor, you've obviously been taking care of Renee, and I know you, again, it's great that you are both able to share with your story, what's going on. Maybe you could share what are the things you've seen now with your patients and Renee's case, if possible, but then, what are the takeaways you're dealing with right now as we sit here a week or so before Thanksgiving?
So the thing with COVID is it's a viral disease that causes inflammation in the body. So when it causes inflammation in the body, there are some organs that it majorly affects. One is the lungs, the other is the heart, and the third would mainly be the blood vessels. So those are the most common things that we see. The media and everybody is almost always focused on how many deaths are coming from COVID. But quite honestly, a lot of people who have not even been hospitalized suffer long-term symptoms from COVID when these organs get affected by that inflammation. So like, for example, the inflammation of the lungs can look like an interstitial lung disease or a mild fibrosis in the lungs, something that causes shortness of breath or chest tightness in the long run. Anything that is affecting the blood vessels can appear like blood clots. I had a patient just yesterday who had a blood clot in the leg after many days of being discharged from the hospital. So he will need blood thinners and stuff like that. And some patients get inflammation of the heart where there is fluid collection around the heart, inflammation of the muscle in the heart, and sometimes even have a heart attack at a very young age after getting COVID. So this myth in the past that young people will not suffer any problems was busted when many young people were having these long-term problems. So there's a lot of things that happen with COVID where you really don't want to get this disease at all.
And Renee, you didn't have issues prior to COVID with your lungs or with breathing, correct?
No, I've never smoked. I've always had a little bit of a cough from allergies, but no lung disease or asthma or anything.
And so, doctor, to your point about the issues here, this is not just for elderly. This is happening for those, as Renee's pointing out, even if you weren't a smoker, these effects of it. When you talk about long-term effects, is that defined as a matter of months, or is that possibly even longer than that?
So we don't know everything about this disease. So what we are seeing is there are some people who get COVID, they don't even know about it. COVID comes, COVID goes, they don't even feel a difference. There are some who get COVID, get admitted in the hospital. Once they feel better, and they go back to their own lives. And there are some who get admitted in the hospital, end up in the ICU, don't make it, or end up in like a rehab nursing home facility, have problems for a long time to come. And then there are others who don't have a major disease to start with, but it goes on for days, weeks, and months, and it's very variable. Depending on which part of the body it affects, those problems can go on for anything between days and months. One of the most common thing that happens to everybody who gets COVID is they will tell you that they feel like they were hit by a truck. They feel extremely fatigued and they lose a lot of muscle strength. Just that one thing, even if no major organ is affected, just losing that muscle strength will make someone feel the effects of this disease for months. Like it will make a problem if you're trying to go back to work, because when your muscles get weaker, your heart starts to pace faster, your heart beats faster, and you get short of breath very quickly. So how much time it takes is very variable between all these patients.
That's great. Well, and I guess the unknown part of this is interesting and it's evolving, right? I mean, I guess you're learning things week by week.
Yes, it's all new information. Sometimes what happens is information that comes in March makes us believe certain things, and in a few months later we get more data and now we learn more things. So certain things that we thought were good, let's say in March, are not necessarily as good now, and certain things which we thought was not as scary about COVID are more scary now, because early in the pandemic we did not know that these symptoms could go on for this long.
And you spoke about the fact that each individual can react to this totally different based upon their age. Is there a level of COVID that some people can have compared to others? Is it a percentage of strength of the strain that people get? I mean, can you get more or less of COVID?
So there are many theories on that. There is nothing absolute, but I can tell you some theories. One theory that is most commonly known is older you are and more diseases you have before you got COVID, the higher chances that you will feel the aftermath of it. And that is true, and that is most commonly seen. There are some more theories where if you have a higher viral load exposure, like for example, a healthcare worker gets exposed to some amount of COVID viral load from a patient, then gets it again from another patient, and this repeatedly happens and they get exposed to a higher viral load, they tend to have bigger problems. There is another theory that men more than women tend to have a problem based on the immune mechanisms that happen in the body. There is another theory that our own body's immune mechanisms fight us and make us sicker. So sometimes I remember we had a 95-year-old patient once. We were very afraid. This was the very beginning of the pandemic. We were like, he's going to get really sick. And he didn't get sick at all. And the theory was he did not have any immune response to fight himself. So COVID came, COVID went, and it did not have anything to manipulate in his body to make him sick. And then there is another theory that we have different strains of COVID. We know at least of 6 strains of COVID. The strain that came early in the pandemic, let's say which spread from China to other continents, that strain theoretically is not there in the United States anymore. Now we have other strains, and some strains are more infectious, but less pathogenic, that you will not die from it, but you'll have a longer disease from it. And some strains are less infectious. You won't catch it that easy, but if you catch it, it's more dangerous. Like some strains, there is more virus in the nose and the mouth, and other strains, there is less virus in the nose and the mouth. So that's how you spread it less. So there are many theories when it comes to that.
Interesting. Now, Renee, you work in the emergency room, is that correct?
Yeah.
So you've had this care there, and doctor, in addition to being a pulmonologist, the other responsibilities you hold are what? At St. Elizabeth.
So I'm also an ICU doctor. I'm an intensivist, and I'm very much involved in things that we do with COVID, like policy making and protocols on how we treat people and things like that. So it's been a very difficult year for everybody, and we are doing the best we can at St. Elizabeth to provide the resources. And I also do clinical trials on medications for COVID. That way, what that does is certain medications which are at the forefront of research, we are able to provide it to our patients free of cost. So that has been beneficial as well.
And I bring that up especially because you both are obviously, you are in the throes of the healthcare pandemic or the healthcare service in this pandemic. So you're seeing it day to day, both of you. And of course, Renee, you're living it, having gone through it. I guess, we could speak about this for a long time, but speak to the issue of remedies to keep ourselves safe. Masking, of course, we're talking about washing our hands, staying distant, physically distanced from others, without getting into the political argument of things. Speak to the benefits of, if you can, masking, and then I'm going to ask you, Renee, what your thoughts are there. So, doctor, if you could speak to that.
So masking is definitely important and necessary. We have other diseases before COVID where masking was proven to be useful in decreasing the spread of the disease. So that information helped us to zero in on precautions like masking with COVID. With masking, what happens is not only the person who has COVID can decrease the spread to others by wearing a mask, where others who wear a mask also can prevent catching it as much as possible. All the controversy that comes is because somebody might say, hey, I wore a mask, I still got COVID. And that is what it comes down to. No matter what precaution you use, it is not going to be absolute. It is not going to be 100%. But you have to do everything you can to prevent it from coming. Like if you go in a car, yes, you can get into an accident, but you have to do everything you can not to get into an accident. Right. Because by preventing COVID, you can prevent all these long-term issues. Even if you don't get immediately sick, you want to prevent this long-term stuff.
That's a great takeaway. Renee, I don't know if you could add to that as well, or if you've, like so many people, we've had a variation of feeling like something works and does it work, and you've been going through this now for 8 months. What are your thoughts there?
Pretty much the same as Dr. Chai's. I mean, being responsible, doing the best you can. I think that St. Elizabeth, I'm thankful for all the care that I received there. My doctors are all there. I feel like that they have really done a good job on trying to keep on top of everything, and a very personable touch that they add to their care. I know sometimes, people get aggravated, they can't do this and they can't do that, but I always tell people, at least you're here. So, just stay safe, and that's the best thing we can do right now.
And we're sure glad you're here and getting better day by day, Renee. And so, Doctor, you've been dealing dealing with the hospital and this issue for a long time now. Maybe speak to the issue of looking at other cities and maybe have dealt with that in other towns and how that affects what you're seeing now in Kentucky.
So I sit on some national committees where we look at how the disease has affected different parts of the country. I have friends, especially in places like New York and Detroit, which got ravaged earlier in the pandemic, where the cases were crazy. Like in Detroit, for example, in the hospital at one time where I worked before, there were like 700 cases in the hospital, out of which 150 cases were just in the ICU. So when you see stories like that, it creates a lot of anxiety, like what happens if that were to happen here in Northern Kentucky. And God bless, we have not had such a huge wave ever, but now we are starting to see a uptick, and now we have more than 150 patients in our hospital. So, initially in the pandemic, you're really geared up, you have the energy to fight anything, and months go by. The community is tired of hearing about COVID. Everyone is tired about COVID. But now all the healthcare community has to get back, bring that energy back in taking care of their population, because now Northern Kentucky is being hit. So we have to do everything we can to stop the spread and take care of our people.
So I would ask you on a personal level, have you been able to have any time off?
I don't think I should be thinking that way. It's been difficult to get any kind of time off. Even if I wanted to, there's a lot of my colleagues who work crazy hours as well. So I would not be able to take time off in good conscience, seeing how they work. So all of us here in the healthcare community kind of support each other to keep going. And that's what is beautiful about being in this community. The people are very supportive. I have patients who come into my office or on video visits or in the hospital who say, "Doctor, please make sure you take care of yourself as well." That makes my day. That makes it all worth it. I have colleagues who support me. If I'm super exhausted one day, they will pitch in and help out. So that's how this is, and that's all we can do.
Well, Renee says you've been a phenomenal physician for her, Renee. I don't know if you want to tell that story again, but that's speaks to the kind of character you have as a healthcare worker. But Renee, I don't know if you have any comment there.
No, I agree with Dr. Chai. I mean, the healthcare community as a whole, we've, like I said, it's tiring, it's fatigued. We practice medicine different now than I think we ever could imagine that we'd be practicing medicine with all of our protective gear on and taking this very seriously. And like he said, supporting one another, picking each other up, you know, when we feel like we get knocked down, and we get up and kind of go back for round 2 and round 3 and round 4. And that's what we're here for.
Well said. I would ask you to wrap this up, Doctor. And again, thank you guys for your great service and time with us today. But if there was one takeaway that you would offer to the Northern Kentucky community as we sit here, what would it be?
The cases are going up, and we should do everything we can to stop the spread of the disease. So we should listen to important voices from the healthcare community. We have to follow the recommendations that are coming from the state, because if we are not able to slow down the spread of the disease, the hospitals are going to get overwhelmed with the number of cases. Then patients who really need hospital care might not be able to get it. So for our own safety, for our community's safety, we have to get above our individual selfishness and do everything we can as a community to help each other at this point.
Great. Thanks, Doctor. Appreciate your opinion there. Renee, you have any thoughts there as we wrap up?
Just keep each other in mind, reach out to people that, you know, have, you know, stayed at home, done what they're supposed to. I think it takes a mental toll on everybody, especially healthcare workers right now too. It's a constant battle day in, day out. We have, I think Dr. Chai can agree, completely changed the way we practice medicine anymore. And it's an ever-changing model. We all get tired, we get fatigued as well. So just keep each other in your thoughts and prayers and reach out.
Well, you guys, you're both heroes. And we talk about our servants in the community, our police and fire and our healthcare workers, but it sounds like we almost overstated so much we take it for granted. But on behalf of the community, I say thank you to both of you guys, and stay well. And thanks so much for your time today.
Thank you so much.
Thank you.